Good evening. My name is Elizabeth Jensen, and I'm the President-elect of the Registered Nurses Association of Ontario. On behalf of the Registered Nurses Association of Ontario and the London Library, which is co-sponsoring this event, I would like to welcome you to our All-Candidate Night. I'm very pleased to see so many of you have taken time to come out to what we hope will be an all-candidate night focusing on issues dealing with health. I'd like to share with you that in the minds of nurses, health has a very broad definition, and it takes into effect those things that include environment, living conditions, as well as illness and wellness kinds of issues. I would like to take this time now to introduce to you Pat Kirkby, who will be the moderator for the evening. She is the past president of the Registered Nurses Association of Ontario, and as well she is the Dean of Health Sciences at Fanshawe College. I know that Pat has a great deal of experience with public groups and with public meetings, and I know that she will do well to moderate your questions for this evening's events. And I will now turn the podium over to Pat.
Thank you, Elsa, and good evening. It's my task this evening to keep this meeting in order and questions flowing so that you have the opportunity to hear the candidates' views on a number of issues. Therefore, the rules of order for the evening meeting are: each candidate will have 2 minutes to address healthcare issues from their perspective. Following the completion of the candidates' addresses, we will then entertain questions from the Assembly. As you entered the Assembly, you were handed a piece of paper on which you are asked to write your question. When you have the question completed, would you please raise your hand and the usher will take the question from you. We ask that each card be signed by the person who has written the question and or the association or organization that is fielding the question. We would ask you also to indicate on the question paper the person or the candidate to whom the question is addressed. I will call time towards the end of the meeting, so we have the opportunity for each candidate to make closing remarks, and each candidate will be allowed 1 minute. Okay? I will introduce the candidates to you starting from my left, and will introduce them as they speak. And the candidates will remain seating as they address the Assembly. The first candidate to address healthcare issues then is Brenda Rowe, representing the Family Coalition Party from the Centre.
Go ahead now. Sorry.
Just stay where you are.
Oh, okay. The Family Coalition Party is brand new. Some of you will not have heard of us. We were registered in June. We are a pro-life party. We're the only pro-life party you will find on your ballot. The only policies that we make concern the protection of life from conception to natural death. Of course, health care is a major issue in the protection of life. We would advocate no funding for any anti-life practices such as abortion or euthanasia. We would try to encourage funding of both denominational and non-denominational hospital services such as Catholic services and public hospital services. We might not have a lot of power right now because we're a little party and we don't have history behind us. But we're in this business because we care, because we love life, and we're here because we love people and we love living. And we want to take that voice of love and caring right into Queen's Park and represent the people who need us to need them. Thank you.
Thank you, Brenda. The next candidate is Vaughn Minor, Progressive Conservative, London South.
Thank Well, thank you for allowing me to participate tonight. A number of us were at a debate here last night, and the lights are a little brighter, and I hope the shine doesn't hurt anybody. PCs, as a party, have taken a stand on many of the issues, but tonight we're talking about health issues. As far as I'm concerned, Ontario has one of the best healthcare systems in the world. Experts from all over the world have looked at our system, and I, for one, do not want it to get to the stage, as in other jurisdictions, such as California, where nurses and other health professionals spend more time worrying about how many bandages they've applied rather than the care of the patient themselves. In Ontario, we should be striving for excellence in health. I believe that government by conciliation and compromise is much better than government by confrontation. An example would be the ban on extra billing under Bill 94. And I would say to you that the approach that was taken in Alberta, where the government sat down with the healthcare professionals and said, we have a problem, let's solve it without confrontation, is a much better way to go. I feel that the certain sections of the health care profession, such as the RNAs, if they have a limited right to strike or no right to strike, there should be some type of time limit on any contract settlements that go to arbitration, and they shouldn't be forced to wait for 18 months. If we all work together as a team, doctors, nurses, hospitals, and government, then the ultimate winner will be the person who needs the help the most. Again, thank you for inviting me here tonight, and I look forward to any questions. Thank you.
Diane Whiteside, NDP candidate, London North.
I'm grateful for the opportunity to be here tonight with you folk. In healthcare, we take so much for granted, particularly when we enjoy good health. I am proud to stand in a tradition in which New Democrats have fought to ensure that when help from the healthcare system was needed, it would be accessible and the best available, and that no one would be held to ransom or ruined financially because of the costs. Such services, licensed and supervised to meet provincial standards and funded from public monies, whether in education, daycare, or the health field, New Democrats believe must be non-profit only to ensure both accountability and accessibility. I am proud of the fight led by Tommy Douglas for Medicare. Most recently, I am proud of the amendments to the Nursing Home Act won by Bob Rae and the New Democrats, which guarantees a resident's Bill of Rights. I am proud of the fight led by Bob Rae and the New Democrats in opposing the privatization of health care. I am proud of the way they continue to fight for accessibility. I am particularly proud of the comprehensive plan by Bob Rae and the New Democrats for community health centers, in which public health nurses together with other supportive professionals can operate to meet with people where they live, meeting the needs of the people with a system that is practical, sensitive, and responsive to their needs. Thank you.
The next speaker is Elvis Mitzall, Family Coalition Party, London North.
Thank you very much. Just to add a point to what my fellow candidate, Brenda Rose, said about not having a history, I think with the record of the other parties, that may be an advantage. Besides, what I like to talk about, and of course what we always like to talk about, is abortion. Another issue, though, that's close to heart is our senior citizen program. We don't believe the elderly necessarily need to be institutionalized. We believe there are elderly that can be taken care of at home by their children. We have a program where we would give a person $15,000 to add a room to their home so that they could have their mother or father stay in that room. Figures show that it costs $30,000 a year to take care of an elderly in an institution. We wouldn't necessarily reduce health care. However, we believe that the elderly need to be respected, not to be institutionalized. I'd also like to discuss the abortion. Under Section 251(4) of the Criminal Code, An abortion can only be committed when a woman's health or life is in danger. I asked the registered nurses here who work at Victoria Hospital to find out if, in fact, one abortion application has been refused in Victoria Hospital in the past 3 years. Quite simply, the reasons for abortion now are no longer medical. They've gone to economic, social, and psycho. Basically, what the registered nurses are doing, and I don't put the blame on them, is aiding and abetting in a criminal offense.
You have 5 seconds.
Oh, thank you very much.
The next candidate to speak is Lucky Clark, Progressive Conservative, London North.
Thank you. Ladies and gentlemen, London is a world-class healthcare community, but the access to these facilities for Londoners is below Ontario standards and inadequate for the people of this community. David Peterson made a 1985 election promise that if he were elected Premier of the province, he would get on with the building of Phase 2 of Victoria Hospital. The Liberal government has not done this to date. Today, there is a crisis that exists in hospitals due to the lack of commitment by the Liberal government. This crisis could be overcome by the following 4 points of action. 1, the immediate funding of 24 vacant beds at St. Joseph's Hospital. 2, the immediate funding of the unopened beds at University Hospital. 3, we should allow University Hospital to immediately build a 40-bed hostel that would, at a lower cost, relieve 40 acute care beds now being used by people from outside London. 4, the building of Phase 2 of Victoria Hospital must include an additional 60 beds, the ones that were closed 4 years ago. In calling for more acute care beds, I am not only doing so tonight because the Liberal government allowed a crisis to develop. My first preference is an expansion of community-based programs, including day hospitals.
5 seconds.
But when community health care programs no longer meets the needs of Londoners, adequate facilities must be available. I'm very proud of our world-class reputation as a health care center. I'm committed to tearing down the no vacancy signs at our hospitals. Thank you.
The next candidate to speak will be Michael Wyatt, NDP candidate, Middlesex.
Thank you very much. It's my opinion that the medical system that we're all so proud of is not quite living up to its potential. Now, when you say that, people tend to become very defensive. We've created an attitude in this province of support for our health care system, which is good. We New Democrats are very proud of that. However, we believe that there's a lot more that can be done. We do not believe, for example, the situation in many of our hospitals, and I could point to many examples where the chronic care patients are occupying acute care beds, and there's quite a bottleneck, and you've got tremendous waste of resources, and we believe that something has to be done about that. The other thing is we believe that medicine and the delivery of medicine and health care should be community-based. Rather than dominated by a medical establishment, we should look at more neighborhood clinics, looking at other professions, professional Medicare deliverers, in terms of nurse practitioners. There's a whole range of things we'd like to introduce. The bottom line is that we believe that we can save a fair bit of money and provide better health care, and use that money to expand our health care services even further. We need to do a lot more in research, a lot more in bringing health care to the doorstep, especially in terms of care for our elderly. We institutionalize the largest proportion of our elderly in any country, I believe, in the Western world. There's much more that we can do. We New Democrats are committed to doing that. An example of how this system, this community-based system, works is already in existence. In Sault Ste. Marie, the United Steelworkers started such a clinic. The result was a reduction of 25% in medical costs. We believe that can be done right across the province to the benefit of us all.
Next candidate is Robert Metz, Freedom Party, London South.
Thank you very much. A 2-minute opening statement demands that I get to the point quickly, so I will. Although it doesn't say why, the Registered Nurses Association's observation that Ontario can no longer afford, either fiscally or socially, to ignore alternative health care delivery models, it is an accurate observation. And I also agree with the observation that many consumers can and want to be involved in their own health care planning, both at the individual and at the policy level. Now, I find the use of the word consumers most appropriate because that acknowledges an economic relationship. They didn't say patient. And when you acknowledge an economic relationship, that means the issue is money. And that's really what we're here to talk about tonight. Making your healthcare profession and our healthcare system totally dependent on government, an institution that's, well, shall we say it, going bankrupt, doesn't serve anyone well, and regrettably, that's what the RNAO has proposed. Healthcare, like education, should be supported by taxes and paid by taxpayers when they are well on income earning, says their brochure. But now, I used to think that this concept used to be called insurance. The only difference in this equation are the words taxes and taxpayers. Now, getting rid of extra billing, user fees, and premiums amounts to nothing more, really, than tinkering with a system that's already really in trouble. In fact, restricting these alternate sources of income to our healthcare system simply leaves the whole system poorer and thus less able to serve more people. And I'm not impressed by the suggestion of getting rid of our OHIP premiums just to hide them under our taxes where we can't see what we're paying for our health care. Consider the future. Thank you.
Thank you. Next candidate to speak is Joan Smith, Liberal, London South.
Thank you. When I was in Nicaragua this spring, I had the opportunity to meet with their Minister of Health, Maria Doria. And it was interesting because in a poor country like that, she said the health budget is necessarily small, that money has to go first for sewers, water, and education, because without these things, health is impossible. Of course, she was talking prevention. Here in Ontario, we put a very high priority on health, and therefore I'm not ashamed to say that the spending of the province, a third of the spending, roughly, goes to health spending. And I think the people of Ontario are prepared to do that. But in a sophisticated system like ours, where knowledge is multiplying every day, the more we discover, the more we can do for people, the more, in fact, we find we increase the costs of the services that we deliver. This is something that society as a whole has to look at, because we all agree, I think, that we must share our health facilities among the people. The government is trying to find completely new approaches, because this is a problem so mammoth that new approaches must be found. We could spend our whole provincial budget on health and still only turn up and find more needs. So in effect, we need to find new, effective, exciting ways to deliver health services that make the best use of all the health providers in the community. This is being addressed by the task force under John Evans. He has made his first report, which will be commented on and brought to the legislature, and recommendations undoubtedly will then come forward to the legislature and be sent out for public discussion. I know that important and new trends must come, and I appreciate that people like yourself who get us involved, get us interested, even though many of the problems are too technical, are doing a favor to everybody. I look forward to participating.
The next candidate is Paul Picard, Family Coalition Party, London South.
Thank you. Ever since I can remember, I'd always admired the medical profession. All those people who were involved with the caring of suffering humanity. We have seen, in a short time, marvelous cures, heroic operations, but especially that great comfort which we know the nurses so often give to those people who really need it in their time of suffering. But now we're faced with the #1 killer in humanity. And it is within our abilities to bring about the end of this great killer. Abortion. It's the #1 killer in humanity. 65 million abortions per year in the world. And who does this killer attack? The young, the innocent, the defenseless, not able to speak for themselves. All we must do to start to put protection is to put protection for the right to life in the Charter of Rights, and then to have a backup crew of people with financial support, emotional support. This would be the beginning of the end of this great killer. But for the mothers that suffer so often, that have desires for abortion, what about them? When the child is born, their sorrow is turned into joy. Now, your profession is thought of as ones that are protectors of life, the healers, the comforters. You provide the works of mercy. You again can regain that great respect to which you are called to. Now, the Family Coalition Party, it would be a voice for the unborn, and it's also a voice to be far-sighted for your needs. It would listen to the requests of your profession, for you know what you need is best, and we would support it with finances to better care suffering humanity with dignity, respect, and to provide the care you can give. Thank you.
Next candidate to speak is Marion Boyd, NDP, London Centre.
Well, I guess I really want to convey to the registered nurses how pleased I am that they are holding this meeting, and that I see in the audience so many people who are from related professions as well. Because as a feminist and as a social democrat, I am very, very pleased to see this participation in political action on the part of a profession which is extremely important to our health care, but which has tended to hold back in the past in terms of political action. I think this time around we are beginning to see that there are more people involved in the health professions than simply the doctors. The doctors were the only ones we met last time. They had particular reason to approach those of us who are running with their particular issues. So I am very pleased that we are talking about the broader base of health services. As a member of the Health Promotion Subcommittee of the Thames Valley Health Council, I am particularly pleased that there is so much emphasis in the literature we've received from the registered nurses and co-professionals in the field about issues of prevention. I guess I have a sense that we have tended, when talking about health, to concentrate on illness rather than wellness. And I'm very pleased to see that in a lot of the questionnaires and the literature we've received from the nurses and the physiotherapists, the social workers, the psychologists, an emphasis on wellness. Because I think that indeed is part of the health system that has been neglected. And I really welcome the possibility that we can begin to look at that as a real possibility tonight. Thank you for having us here. It is a great pleasure.
Excuse me. The next candidate is Dave Wininger, NDP, London South.
Many of us are aware of the rising challenge to the healthcare system. We're aware of rising public expectations with regard to healthcare. We're aware of the constraints on public resources. We're also aware of some of the concerns of the healthcare providers. How has the Liberal government met this challenge in the last 2 years? I suggest to you that the Liberal government has met this challenge with a string of broken promises. They failed to deliver on free OHIP. They failed to deliver on free dental care as promised for our school-aged children and our senior citizens. They failed to deliver on better access to government material in Braille or in cassette form. They failed to provide health insurance coverage for devices such as wheelchairs. They reluctantly ended extra billing at the bequest of the New Democrats, and yet gave $41 million of the over $100 million in federal transfer credits to the doctors. I would certainly adopt the recommendations of the recent Evans report on health care, which called for greater emphasis on primary care for integration and coordination of healthcare services to achieve a more community-oriented focus on healthcare and treatment, and certainly the promotion of health and disease prevention. And certainly I would call for universal access to medicine without extra billing or extra premiums added on. And finally, I would say, with regard to one of the most prevalent problems today in the healthcare field, our party would commit itself to $30 million over the next 3 years in funding for AIDS education and prevention.
The final candidate then is Dennis McCaig, PC, London Centre.
Good evening, ladies and gentlemen, and health caregivers. I applaud your efforts in bringing health care to the spotlight in this election. I feel it's a crucial issue because I've worked in the healthcare system over a number of years as an ambulance officer, and I've seen some of the problems that you've had to deal with, and I know some of the frustrations that you're faced with. I also wanted to tell you that I'm here tonight to answer your questions and your concerns as a Conservative candidate, while your MPP for London Centre is at a ballpark in Brampton. He seems to place more priority on picnics in this campaign. Maybe he thinks politics is a picnic. But I'm here to tell you tonight that politics is a caring profession, like health care. Currently in the City of London, we're seeing a wait of up to 6 months for acute care beds and surgical beds in the local hospitals. That's because, ladies and gentlemen, as you well know, that there are the geriatrics and the disabled in beds that could be allocated to acute care. And there are geriatric patients and disabled patients in those beds because there are no room in the nursing homes for them. And there are no room in the nursing homes for them, ladies and gentlemen, because the Liberal government has failed to provide community support for these people, has failed to provide the funding that's necessary and the commitment to accomplish the goals that we would like to see in deinstitutionalizing those who do not need to be in the nursing homes but should be in a home environment. And my colleague, Mr. Winninger, has referred to the string of broken promises left by the Liberal government. I submit to you tonight, ladies and gentlemen, that it was due to the NDP that they were able to break those promises, because there would be no Liberal government had it not been for the NDP. Again, in closing, I just want to say thank you for inviting me, and I look forward to participating and responding to your needs tonight. Thank you.
You have heard the candidates address their concerns about health care. Now we move to the question portion of tonight's program. The first question will be addressed to one candidate from the Progressive Conservatives, a Liberal candidate, and a NDP candidate. The question is, recognizing that 10,000 Ontario residents die each year from smoking-related illnesses, that secondhand smoke is a proven health hazard, and that many U.S. states, including neighboring New York State, have enacted comprehensive smoking control laws, do you and your party favor the enactment of a comprehensive smoking control law for Ontario? And will you propose such a law on the next sitting of the legislature? Mr. Minor?
Coming from a tobacco-producing region, that's where I made my money to afford to go to university. That gets to be a bit of a tough one. I believe, though, that with the inherent dangers of smoking, that we would certainly be interested in looking at some sort of law like that, as long as it did not infringe upon the rights of others.
Diane Whiteside?
I personally feel that Now, I don't know with regards to the New Democrats how they feel about a comprehensive smoking control law. Are we in agreement with that?
We'll tell you,
You wanted to go third, right?
Thanks. Well, there's your answer. No, I would think that'd be an excellent idea, because I would tend to think that smoking does contribute to lovely sound, to cancer. It may contribute to it. It hasn't been proven yet.
Comprehensive paper ripping policy.
What? Depends on. That's right.
Thank you. Excuse me, sir. Ms. Whiteside was responding to the question.
That's fine. Thank you.
Joan Smith?
Yes, I would. Thank you. I would like to say that I think among the three parties, as a matter of interest for how the various parties stand, there's been a fair amount of support to non-smoking legislation, and some indeed has been passed in the House. A private bill was introduced first by a member of the Conservative Party, as a matter of interest. But it did seem receive general support. Smoking in the workplace is what he was talking about, which did in fact then become a bill that was referred to committee and so on. The big question here is what you mean by comprehensive in the question. I think we're moving to more control all the time. A comprehensive could go to, does go then to include all workplace. By comprehensive, what more do you mean? I think the word is somewhat vague. I think society is becoming accustomed to less smoking except in their private quarters, and this will continue to be the trend.
Thank you. The next question is directed to no one specifically, so I will leave it open, and whoever answers first is the winner. The question: in September '86, the Ministry of Community and Social Services publicly announced their responsibility for funding in the area of family violence. To date, all family violence service providers in London have been extremely underfunded. That is, the Women's Community House, the Battered Women's Advocacy Clinic, Changing Ways, Family Service London. At this time, the majority of our funding at Changing Ways comes from the United Way on a temporary basis. The United Way believes the government should be responsible for this community-based service and will be gradually withdrawing funding. If you are elected, what do you plan to do about this problem?
Something tells me this should be my question. It certainly is true that although the general public may feel that the initiatives announced by the 12 ministries, first of all in October and then reinforced in April of 1987, may have sounded to the general public as though they took care of the problems of service providers in the family violence field. In fact, the reality is that for those of us who provide those services, those funds have not flowed to the extent that we would like. Now, there have been changes, and it's really important that we see that there have been great strides in the area of funding family violence, and also great strides in terms of the legislative provisions that have been made to protect victims and to try to provide service to perpetrators and also to the innocent secondary victims, the children. And that has happened. The problem has been, for those of us who are service providers, that the publicity campaigns, the Break the Silence campaigns and so on, have really encouraged the victims of family violence to come forward in greater numbers than the services can accommodate. I have, in the clinic that I operate, we have 4 full-time staff, and we on a monthly basis are now running at a caseload of about 150 clients whose needs are very urgent and very serious, and there are no areas where we can refer those clients. I know that the same is true of Women's Community House, where they turn aside one family of women and children for as many families as they are able to serve. So although
going to
there has
call
been an
time on the
improvement, it is really serious. Just want to finish on changing ways, because there has been great emphasis placed on the need for treatment for batterers, because they are responsible for the violence. And yet, despite all the rhetoric, the kind of long-lasting service to men's treatment programs has not been forthcoming, and throughout the province, the men's treatment programs are finding it harder and harder to carry on.
Thank you. Mrs. Smith, you...
Yes, I think that Marion knows that she and I have worked together to try and increase funding, and I will continue to work to increase funding in battered women areas. To say something good for the government in this area, in 86-87 it was increased to 5.4 million. By April 87, 7.1 million additional funding was added to it. 800,000 for counseling programs, 800,000 for public education, 4.5 million for shelters. Another additional announcement was made by the Ministry of Housing for a shelter here, which is a backup shelter to this for the longer-term second stage battered women in this community. And as well as that, one of the early things done was to put emphasis on letting battered women go to the top of the waiting lists of Ontario Housing, so that as soon as they were identified as battered women, they went to the top of the list rather than being just straight at the end of a long list.
I'm going to call time on this. There's several candidates wish to respond.
That's okay.
And I have in my speaking order Robert Metz, Michael Wyatt, and Elvis. Okay, Mr. Metz.
Family violence is a crime and should be dealt with as such. And that means a perpetrator of violence is a person that should be held responsible for any costs incurred to that. I do not agree with the concept that as a consequence of a violent act that we as taxpayers in this society should have to pay for the consequences of that violence. That is not the proper approach, and in either case, if we're trying to rehabilitate people who are prone to violence, we're not doing them a favor by paying for the consequences of their violence for them. That's their responsibility, and it's part of the lesson that they have to learn not to be violent in a society such as ours. Thank you.
Thank you. Mr. Wyatt?
I have little to add to what my colleague Marion Boyd has said, but I do represent, trying to represent a rural riding, and there's a particular problem with families in rural ridings in dealing with domestic violence. I know it's a commitment of myself and of my party to extend such services into rural areas so that we can start to do something about the problem out there.
Thank you. Mr. Mitzel?
The Family Coalition Party would increase funding to such programs drastically. The family is the cornerstone of our party, and quite simply, anyone attempting to destroy the family must be treated like a criminal. One more comment. I just want to assure the registered nurses in the audience that we're not about to throw them in jail for participating in abortions. We just want to remove them from the precarious position where they're participating in abortion which has not been followed, has not gone through a therapeutic abortion committee, etc., and possibly could be put in jail. Thank you.
The next question has been directed to Mr. Miner from London South. Is that correct? Yes. The question has been submitted by Jackie McKenzie from the Hospice of London. The question is, sir, what has happened to the discussion paper prepared by Mr. Grossman concerning palliative care and recommendations for funding of same?
Well, to be perfectly honest with you, I'm not sure exactly what has happened to it. I guess when you get elected and you want to help people and do things, it's your local representative that has to be you have to request the action from that person, and you have to keep on that person until the action is satisfactory for your purposes. But to be perfectly honest, I'm not sure where that stands, and if you'd like to come to my constituency office the day after the election, I'd be happy to help you.
Thank you. The next question is directed to one candidate from each party, and you can decide among yourselves who shall respond. I will watch for hands. The question is, In Ontario, there is a shortage of qualified physiotherapists, largely due to limited university funding for educating students. Positions in both hospitals and private practice are not being filled, creating several problems, including further delays for outpatient treatment while patients are on lengthy waiting lists, decreased inpatient services when positions remain vacant for any length of time, and increased cost in recruiting foreign-trained physiotherapists. Does your party consider a lack of qualified healthcare professionals to be a problem? If so, what actions will your party take to begin to resolve the situation? Mr. Metz?
Once again, the problem is lack of funding, money. The sad fact is, some of the things that are being proposed here tonight are the very things that are creating the problems that are being presented. Getting rid of things like extra billing user fees and premiums is a big mistake. We not only need those things in our healthcare system, we need to rethink our entire healthcare system from scratch. We must begin by ending the concept of universality and recognize that this is the only way of saving our healthcare system if we want to have one in the future. The idea of 100% of the people helping themselves to the pot of money 100% of the time has never worked in history. It doesn't work. And the sad fact is that while we may pay a lot of lip service to saying that we put these systems in place so that we can help those who cannot help themselves, I'm afraid the sad truth is we're helping ourselves.
Thank you.
Thank you.
Mr. Miner?
It's a sad commentary when things are underfunded. But just to use a couple of examples of current funding projects that seem to have some amount of media fanfare, exactly as was explained earlier, the $12.5 million for family battering worked out to something like, if I have my numbers right, $27 a family per year, which brings it back to reality. It's the same type of problem that you have when you get all excited about announcing another $26 million for roads in northern Ontario until you realize that it builds 20 miles of roads and there aren't two places in northern Ontario that are that close together. What we've got to do is we've got to have better fiscal management so we can pay for the programs that we need. In the last 2 years, our daily interest costs in Ontario have gone up by $2.4 million every day. And I suggest that that money could be better spent if we had better fiscal management and we could use it on programs that are needed. We'd certainly take a look at the, I believe this gets into some of the specialization and the underfunding of universities. We are committed to increasing the funding in universities and looking at the entire education system. So I believe that that would be the answer to that problem, or at least a start. It would be a start to the answer.
Thank you. Brenda?
That there isn't enough funding for physiotherapists is that physiotherapy hasn't been recognized as the great need and benefit that it is to people. They get in the hospital, they have a stroke, they recuperate, they're given a walker, and they're told to go home. And people are now starting to recognize the fact that with proper physiotherapy, people can get up on their feet and they can walk home. Accident victims who have had spinal cord injuries can regain use of limbs with proper physiotherapy. And to promote your profession is the beginning. You have to make the people and the politicians aware of what good work you do. I agree, we need more physiotherapists. We need patients able to receive physiotherapy the very day they need it. And we need physiotherapists that can make home care visits under the OHIP home care program. I would be more than happy to go into Queen's Park and ask for that quite loudly in the legislature.
Thank you. Mrs. Smith?
I think the question was why we aren't doing more about training physiotherapists, and indeed I could add to this audiotherapists and other specialties that are becoming more and more vital to our system, as has been pointed out, because people live longer and etc. I've asked this same question, and I can say that I don't think any of us are yet in any way satisfied with the answers, because it's all still so much in process. one of the problems, as was pointed out or touched on by Mr. Minor, is that a lot of this falls into the jurisdiction of universities and how they choose to use their money as allocated. The funding to universities has drastically increased, and the universities have expressed their extreme satisfaction with the reversal in underfunding that was occurring. I think there should be a lot of pressure put along with the funding to make sure that the universities do indeed start providing more of this sort of funding. This indeed is one of the types of areas that's being looked at by the John Evans Committee, and considering that he was president of the university, I hope, of Toronto University, I'm hopeful that the kind of solutions that he will be recommending and putting into place will be something that bring about cooperation between government and university to produce the graduates that we so desperately need.
Thank you. Yes, sir.
I would concur with what Ms. Rose of the Family Coalition Party said earlier about the general effectiveness of physiotherapy. I myself have found that the physiotherapist can go a long way towards hastening the recovery of accident victims, particularly those who suffer whiplash injuries. I don't agree with Mr. Metz that these people should be resorting to self-help. I'm not so sure that fiscal restraint is the solution, as I believe Mr. Minor suggested. I think that physiotherapists should have direct access to patients. It shouldn't be only on referral of physicians, that there should be OHIP generally available to cover the services of physiotherapists, and that they should be treated as an independent and self-regulating profession, just as the chiropractors are striving towards.
Thank you. The next question is directed to any candidate from the Progressive Conservative Party, the New Democratic Party, or the Liberals. The question is, the registered nurse of the future will require greater knowledge and expertise. The Registered Nurses Association of Ontario has identified a degree in nursing as the entry level to practice by the year 2000. How will your party fund this nursing education?
I think that is the same type of problem that was encountered in the CA profession, which also required a university degree starting in the year 1972. CA profession required no funding. What they required was an enhanced university program that properly taught the courses that would be required for the CA designation. And I would suggest that a similar route would be one that you would want to take in the nursing profession, because the RN, I guess it's a Bachelor of Science in Nursing, is an extremely, extremely difficult course. I've had friends that were in it, and it's a very difficult course. The only thing I would caution you on is making sure that by implementing this program, you do not, in fact, discourage people from becoming nurses. You will see that a lot of people would want to become nurses, both male and female, under the current system. It's a 2-year program. Now, to subject them to a 4-year university degree may just be a problem in getting people interested in the profession. I believe, however, though that a university degree would certainly be most beneficial and would add to the credibility of an already good profession. The funding, to answer the question, would have to come in the form of university courses, and I don't believe it would be funding directly to a profession.
Thank you. Could we have a response from an NDP candidate?
I certainly think that there's probably very few professions that have seen as much change over the last 25 years in terms of the style of training and education that has occurred. And certainly with the changes in technology, the changes in medication, the very great advancements that have been made in terms of medicine, the concern that the Registered Nurses Association has expressed about the level of expertise required by the year 2000 is certainly understandable to us all. Certainly our vision would be that there be a cooperative effort in the profession between the colleges and the universities which now train nurses to ensure that there is an adequate mix of practical experience as well as formal education, to ensure that the nursing profession continues to have the kind of practical expertise as well as knowledge base that it has striven to achieve in the past. I think a great deal of negotiation is likely to be necessary because of the way the courses have developed. I think those of us who can remember what it was like when the courses went out of a hospital base into a college base and the disruption that caused and the real heartaches that caused for people in the profession would want to be very, very careful to ensure that there were a lot of preliminary negotiations that ensured an agreement in the profession that was going to be supportive for the profession as a whole. I certainly think that the qualifications that are being suggested by the association are the kind of qualifications that are going to ensure nurses the co-professional status that they indeed should enjoy now, and that we certainly envision that they should do in the future. In terms of funding, it is simply a question of priorities in terms of training. If this expertise is necessary, if this kind of training is necessary, as I believe that it is, then we simply are required to devote the funds that are required to it. And we certainly will get back in returns in terms of the efficiency and the level of care of the nursing profession and the medical system altogether, the kind of return that will make that money well worth our while.
Thank you. Mrs. Smith?
Yes, I think the question says by the year 2000, and we're talking about, once again, the delivery of health care in transition, which it already is. We have graduate nurses now graduating from universities. We have most of them graduating from colleges, and we no longer have any graduating from hospitals. And of course, the costs will follow the pattern of the costs of the institution that you're being trained in, likely. And I know, for instance, that in universities, the cost of training a doctor is, I think, only a seventh paid for by the student, and the balance is picked up by the public dollar, who has engineers at something else, art students at something else. I can't tell you, even right in this year, let alone in the year 2000, what the percentage of cost is with a nurse. That really isn't the point. The point is that we should be training people for the work that they're going to do in the most efficient way and with the expertise that they need for that work. If that's parts of that latter are in community colleges and parts are in university, then that's where they should be handled. The expertise should be acquired at the proper level. Probably, we would hope the pay level of the graduate would follow, even in spite of the fact that most of them may be women. And the ongoing negotiations of costs of these would be parts of major policies between universities, colleges, and governments. But one of the most important elements there is that I think everyone agrees there has to be more flexibility between colleges and universities so that you can carry credits back and forth, so that what you learn in one is recognized in another, so that if you get part of your training in one, you aren't cut off from carrying that on into the next. These things are part of the overall transition that must occur that I've already referred to.
Thank you. The next question is directed to Lucky Clark, PC, London North, and Diane Whiteside, NDP, London North. The question was submitted by Tom Hoffey. The question is, what role do you foresee for midwifery in the delivery of obstetrical care in the province of Ontario? Mr. Clark.
I think in that particular area, I can see that by the midwifery organization coming into their own and starting to be recognized as part of our community-based program for health care to reduce our costs and to improve accessibility. I see them operating under the direction of a physician, but there certainly is a very key role and probably an expanded one that they could play there.
Thank you. Diane Whiteside?
Personal experience, I had the great opportunity of helping to deliver my niece a few years back with the help of a doctor, of course, in the home. The New Democrats support the increased use of licensed midwives as a valuable health care alternative. We don't necessarily agree that midwives should be registered nurses, especially as there are well-trained midwives with extensive experiences and alternate qualifications. We would hope that any legislation arising out of the healthcare profession review, which the Evans report, would spell out equivalencies for the licensing of midwives, which would include, but not be limited to nursing registration.
Thank you.
Just to briefly comment, I can't, for the life of me, the name of the report escapes me, but there has been an independent report submitted on the midwifery, which has the support of the association, which recognizes them as a separate and independent professional group standing on their own, and Marie Austin has guaranteed that this will be acted upon and put into place.
Thank you. The next question is directed to Mr. McCaig, PC from London Centre. And I cannot read the signature on it, so I will attempt to read the question instead. The question is, sir, how can those of us who remember the hatchet job the PCs did on health services in 1976 appreciate your sudden concern?
I think I know where that came from. But I was not part of the government in 1976. I'm recently been involved in the party. I have a new vision for the party, a new vision for health care in Ontario. And I invite you to help me share that with the people of Ontario.
Thank you. The next question is directed to a candidate from each party. The question is, how do you justify a program of assistance, the Assistive Devices Program, that discriminates according to age of recipient? What is the next step in correcting the discrepancy?
I'll answer that very briefly by saying I don't defend it at all, except to say that along with many other of the programs, it was one that was brought in by degrees for fiscal reasons. You couldn't do everything in the first year, and it's recently been announced that it will be completed and made universal by the end of 1989.
Thank you. Mr. Miner, did you have?
Well, I was aware that there were some changes going on in that program. I, as a matter of fact, got a call from a lady who required this type of assistance, and she was not of an age that allowed her to qualify for the funding. So I would think that based on the numbers, it should be brought in as quickly as possible.
Thank you. Yes, sir.
Certainly any age discrimination with regard to the availability of assistive devices should be eliminated. It's obviously in conflict with the Charter of Rights and also our Ontario Human Rights Code. In addition, of course, to making these assistive devices accessible to people of all ages, there's also the question of paying for repairs. Obviously, it doesn't do the recipient any good if they can't get the repairs covered as well, simply because the cost of repairs is well beyond their financial means.
Thank you. The next question has been submitted by Scott McCabe and is directed to you, Mr. Winninger. The question is, recently Health Minister Murray Elston turned down the psychologist's request for fee-for-service participation in OHIP as a matter of policy to control the OHIP budget. Subsequently, $41 million was added to the OHIP budget for physicians who abide by the ban on extra billing law. This is 70% of the cost for psychologists' access to OHIP for 1 year. It is well known that psychological services reduce unnecessary visits to physicians for diagnostic testing, etc. Currently, many individuals in Ontario are being denied access to psychological services as a result of the lack of access to OHIP and inadequate alternative sources. What would the NDP do to provide access to these services?
Well, the NDP would certainly provide immediate full funding for psychological services through OHIP. I think the statement made in the question itself is convincing enough in that our statistics show that a large proportion of our disease in general is related to mental problems. And psychologists can certainly play a very influential and preventative role in counseling people before they have to resort to hospital services and the care of psychiatrists. And our party would certainly support the extension of full OHIP funding to all psychologists.
Thank you. The next question is directed specifically to the Liberal candidate, and we would welcome responses from other candidates. The question has been submitted by Judith Hutchison, Regional Representative for the Ontario Nurses Association. For those of you who don't know, that is the Nurses Union. After many years of lobbying, there is still no arbitration mechanism for community health nurses seeking fair and equitable contracts. Would your party introduce legislation to provide arbitration for these nurses? Mrs. Smith.
Arbitration, because health services are essential services, is the way of, in many cases, settling these things. I know, for instance, that during the last election, the physiotherapists in the public health unit were on strike, so that in that case, it was not an arbitration situation. I'm not sure to what extent all nurses should be under arbitration or not, how much you would define them as essential. In truth, I think this is the kind of detail that hopefully is being worked out. The College of Nurses is the only body that has got itself in the position of being fully self-regulated, fully in control of standards and so on and so forth, and in a position to negotiate. And I think that when arbitration becomes part of the game, one of the most important parts of it is that the method of arbitrating be set out and fair. I know that some nurses in the hospital here are very unhappy with the length of time the arbitration report is taking, so saying for or against arbitration doesn't resolve it. And for instance, that should be looked at, that there ought to be a limit of time to how long arbitration can take. It's a big package of problems around arbitration, who can strike and how long the arbitration. But I will say that the one piece of legislation that I was involved in that touched on arbitration, and the only one I've been involved in my 2 years, it was the first contract legislation. And in that, we did very strictly set out the limits of time to be involved in the arbitration study. So I think people are realizing the needs to look at arbitration, the process, who should be in it, and so on. I can't give you any fuller answer than that without more information.
Thank you. Ms. Reddy.
Yeah, the Coalition Party would not bring in arbitration. Quite simply, we'd give you the right to strike. Now, it can't be unlimited strike. Surely you realize that that would be chaotic. However, we believe that you should be allowed to strike because Joan Smith suggested arbitration is part of the game. It's not part of the game. The bargaining process involves two parties, and they have to have the ability to walk away from the table taking what they brought there, either their labor or, in the case, their money. We would allow some type of rotating strike or some other process where you'd have an ultimate weapon and you'd be able to bargain. Bargaining, quite simply, is unproductive and useless unless you've got that weapon.
Mr. Miner?
Well, having the right to strike but limiting the strike is sort of being like sort of pregnant, and I don't think that fits in with your program. Medical services are an essential service, and the right to strike has been removed. Therefore, I think it is only fair that arbitration be brought in that allows for a sufficient time for both sides to present their case and have a quick decision made. The case of the RNAs that have been out or have been without a contract for 18 months is simply not fair to them if the right to strike has been removed.
Thank you.
Thank you.
I think it's one of the interesting ironies that nurses are designated as essential personnel in hospitals and doctors were not. Doctors had the right to strike. I guess as a New Democrat, I always have real qualms about the whole notion of expanding arbitration, because arbitration leaves the parties with out very much decision-making power, and that is always a concern. I certainly believe that nurses are essential to our health care, but one of the things that has always distressed me is the lack of power that has resulted to them in the bargaining process because they have no sanctions against their employers. So I find it difficult to really be very enthusiastic about the notion that we extend that arbitration requirement to areas of nursing where the right to strike now exists.
Mr. Metz?
I've got to admit that initially I wasn't aware that there was no arbitration mechanism for the contracts facing the nurses in this province. But I have to question why nurses dedicated to a field of medicine, and I've read all this literature saying how much they're concerned with our health care, for what particular reasons they might go on strike. One of the things that I've learned
I'll tell you.
well, one of the things I've learned is usually better working conditions or more money. And generally that means more money going to the nurses and less to the patients themselves. I think that when you're caught in a position working for a government monopoly in a service, that you're really not going to have a satisfactory answer to this type of question. One of the things that has to occur is we do need competition in medical services, just like competition benefits every other service. And although that may not be a popular notion today, it's one of the notions we better start entertaining if, as Joan Smith earlier said, we need more creative ways to fund our healthcare system, of which the nurses are part.
Thank you. The next question is directed to a candidate from each party. The question is, how is your party preparing for the enormous drain on the healthcare system that the AIDS epidemic is going to cause?
It's an issue that enters into every generation of life. It affects all of us. And it has to be addressed on all levels, not just in the healthcare field, but in the education field, in the religious field, and in the political arena as well. The Family Coalition Party sees AIDS as a major issue that needs to be addressed immediately and given priority and precedence when Parliament reconvenes. We want more education in the public schools, not only on how to identify symptoms of AIDS and protect ourselves in your very basic biological questions answered about AIDS, whether you can get it from a mosquito or not. We also want our children taught in the schools from day one, from the time they're old enough to know about ovulation and intercourse, that the only safe sex is chaste sex. Condoms in the public school bathrooms are only going to result in a 19% failure rate, and we'll have more AIDS. Someone else would like to address it.
Mr. Clark?
Yes, the Progressive Conservative Party is not just looking at one program. We're concerned about the whole funding of the whole health program. And we believe that in any case we've got to look at preventative health care, which is going to help us down the road. It's going to be 20 years in coming, though. In the meantime, what we have to do is we have to look at community-based health care centers. We have to look at making sure that we don't have people in institutions when they could be cared for at their home. And I think through that type of program, we can also address the AIDS problem.
Mr. Wyatt?
Ladies and gentlemen, the New Democratic Party recognizes AIDS as a very, very serious question. Recently, our leader, Bob Ray, announced a $30 million program to be over 3 years for AIDS education. We believe the battle against AIDS can be won. We need to stress preventative measures. We also need to stress the fact that this is a disease that we have to fight as a community. There are no groups responsible for it. It is a disease that we can all get, and it's a disease that we have to unite as a community to fight. We are also committed to more research into the question of AIDS. I believe at our last federal convention, the New Democratic Party endorsed a rather large, substantial increase to research into this problem. We believe the fight against AIDS can be won, and we believe that we have to unite as a community and just start to get the process done in terms of fighting this deadly, deadly disease.
Thank you. Mrs. Smith and then Mr. Metz.
AIDS is a new and frightening disease, and I'm sure the more it becomes a problem, the more will have to be spent on treatment as well as on research. The provincial government has already pledged and is in the process of building the Casey House AIDS Hospice, which will open in the fall of this year. It's $1 million capital funding and run as a hospital satellite, really addressing the palliative care as well as the health care problem. They've introduced the educational program in grades 7 to 13 as a preventive technique. They put over $2 million into Red Cross blood screening. I'm sure that I've been trying to recall, there was an announcement, I believe, of some new funding for AIDS in the last week or so, but I can't put my hands on it, and I don't have it here. But I'm sure that as a growing and urgent problem, it will get the growing attention it will need.
Thank you. Mr. Metz?
I think once again we've been sidetracked by a very popular and newsworthy disease, AIDS. But the question was, how are we going to deal with the drain on the healthcare system with regards to this disease? Well, I don't think that question's any different with how we're going to deal with the drain on the healthcare system with regards to cancer or with regards to old age. I don't know if anyone in this room has noticed, but our governments are in extreme deficit. Have you looked at it lately? The governments of all levels. Our hospitals are in deficit. I think a more important question is, how are we going to pay for that? And we have to consider, too, that when it comes to government, there are many other lobby groups out there asking for money for their causes that are just as the causes here tonight. And all of this comes out of one person's pocket, and that pocket is the taxpayer. I'm afraid that there's no simple answer to this question. We have to start searching out for every possible means of cutting costs and increasing revenues to the healthcare system. I'm totally in favor of more home care, which is one of the things suggested by the Nurses Association. I think that's a great cost-cutting measure, but we definitely have to introduce other options into funding. The question is money, and it would be so easy for me here to join all of my colleagues and simply tell you, sure, I'll give you money. That's what each one is telling you. They're just clouding it with a little different explanation.
I'm going to...
Okay.
Oh, thank you, Mr. Metz. The next question is directed to a candidate from each party, and the question has been submitted by Jane Finan, RNAO member. The question is, with the passage of the Canada Health Act, the services of other healthcare practitioners, that is, nurses, physiotherapists, dietitians, etc., can be insured where the law of the province so permits. What plans does your party have to implement this legislation in Ontario?
Would you read the question again?
Okay. With the passage of the Canada Health Act, the services of other healthcare practitioners, nurses, physiotherapists, dietitians, etc., other than physicians, can be insured where the law of the province so permits. What plans does your party have to implement this legislation?
Some common sense, and in agreement with what my colleague and friend Lucky Clark has said, that's part and parcel of the entire health package. And we can't just go on spending. I think it's got to be planned, and it's got to be proper. With proper planning, the needed programs can be provided. Without proper planning, we're just going to add to our big debt load, which is already $35 billion. So if we plan...
Sitting here,
excuse me,
sir. Party line about shut your freaking mouth. with the Conservative Party lying about PCBs, and I got them in my body now. And Joan Smith didn't help me either. I'm so ashamed of myself to stand here with this piece of paper and have a heart attack in my body. And you guys, the Conservative Party, Liberal Party of Canada, did not help me at all.
Well, I'm sorry about that.
And you're so sorry that your shit stinks. To say you're sorry.
Excuse me, sir.
You should be talking to the compensation board and say, why didn't you help this man?
Would
You
you
know, the compensation board said to me, I'm too fat. They
If
said I
you-
drink beer, I don't drink beer. The last letter I got from them people, oh, shut, get out of my way. The last piece of letter I got from them, they said to me, when you get over your sickness, they didn't even have the guts to say I had a heart attack. And don't tell me, so many professional people in here, they laughed at me in St. Victoria Hospital when I told them I had
Sir.
PCBs, they had a heart attack. And I'm a victim of cruelty by doctors.
Sheriff, sir, you have another one.
If I have to have another one tell the truth, I'd be glad to have it.
Perhaps you would like to continue your conversation with Mr. Minor
You guys, the
out of the hall.
Constitution says I have my freedom of speech, and you guys are telling me I don't have it.
The rules of the Assembly are written
The
question.
Constitution of Canada says we have a freedom of speech.
We've heard your
That
comment.
is started now. And I jump up and get my get out of my way! You call the police, I ain't moving.
Call him right away.
No, I ain't moving.
Sir, I think you have every right to be angry. I knew Geff. He was a friend of
Because
mine.
the last time I was at this...
I think I can give you some
Take
answers.
me out too.
I think I can give you some answers if you can listen. There's a lot of business that goes on in Queen's Park. There's millions and millions and millions of letters and telephone calls and questions and people asking for funding and asking for recognition, and it's hard to get your needs paid attention to. Every day there's petitions being signed, and there's strikers carrying their signs. It's really difficult to get what it is that you need recognized by the politicians. I myself, and I know some of the other politicians up at this table as well, have become very aware of the fact that pollution is a worse enemy to us than the nuclear bomb. And we want it cleaned up. We want those PCBs taken out of Pottersburg Creek, and we don't want any more put in. And we've heard you.
And they're still coming in the Greenway sewage plant yet. And I did, just last year I was told about them coming into the plant. And they're coming from the dumps. Now when are they going to stop them coming in?
We need laws. We need very strict laws.
We need people that are going to do something for us.
That's right.
Tell us law. Because they make them, now Joan Smith's office tells me to go to another part of the compensation board.
We
Now,
need...
how many more people in the government I want to talk to?
We need to go back into
Okay.
Parliament and make legislation
You
that will
have-
prohibit that dumping.
For us people who are victims of chemicals.
And we
I
have to
think-
stop it
If
from
I was a
happening.
Ontario Hydro worker, I would have help. But as a city worker, I have no help.
Were you exposed to PCBs through
At
your
Greenway
place of
plant,
work?
I worked there for 27 years. I have crawled through sewers of London.
Sir,
Well, certainly part of our NDP platform is to allow workers the right not to work under unsafe working conditions.
But when you work now as a victim in your blood,
the question...
your emotion that they cause you in your blood, and the question is trying to shut me up.
No.
I don't
agree.
like being shut up.
Sir, I don't think we can solve your problem, but what we're going to do, no, if you listen to me, sir.
He's talking about now, why
I don't-
people have to talk like this?
I don't think we can solve your problem, but what we've got to do is make sure that it doesn't happen to other citizens in this city and in this province. You have been a great example of what can happen.
You're not going to talk to the compensation board?
We're going to talk to the compensation board. In fact, do you live in London Center,
I
sir?
live in London.
Which-
I'll meet you there tomorrow morning at 9 o'clock.
I'll be there.
Okay.
Thank you.
Because the people went to a chance
Sir.
meeting, you shut your mouth.
I'll be
I
at
believe
compensation
you've
with you.
had your time on the floor.
And she told the person, don't go to the free press.
Sir,
I'll be
you've
at the
had your
compensation with you tomorrow. I'll
hearing
talk to you after the
tonight.
meeting. I'll give you the number, and we'll be there tomorrow morning at 9 o'clock. All right? How's that for action?
I'll be there,
The-
I'll be there with a loudspeaker.
All right?
The next question is directed to Marion Boyd. And the question is, it has been submitted by Edward Kiernan. Canadian Youth Pro-Life Organization. The question is, would you, if elected, prosecute Henry Morgentaler under the new extra billing laws for charging $275 to $450 for his abortions?
I would not, expect myself to be in the position of prosecuting directly. I would think that if we have a physician in the province who is extra billing, that would need to be looked at. To my knowledge, there has not been a claim made on extra billing through the process that has been developed for Dr. Morgentaler. But certainly that process is there, and that would have to be looked at because it is available for any citizen of the province who is charging a doctor with extra billing. And it would seem to me that would apply to any physician in the province.
Thank you. Mr. Wyatt, did you?
I guess we're being asked, sort of under the cover, what is the NDP policy on abortion? And
No, that's the question. That wasn't my question.
No, it wasn't? Sorry.
No, just, do you plan to prosecute him for extra billing? Because the maximum amount under the present legislation is $95. All I want to know is, do you plan to enforce the rules on people who use Facebook?
Thank you.
We would certainly attempt to ensure that there's no extra billing going on in this province.
Oh yeah, they told me the police coming here. I'll wait for them. The only place I got justice from the police department was in Cuba. And I'm ashamed to say that.
Okay, the next question is directed to Mr. Minor, London South, and has been submitted by Judith Hutchison, ONA. The question is, many employers have indicated that they are unable to hire specialty nurses. Would your government provide funding to encourage entry and retention of nurses in specialty areas?
I think the way we would probably have to answer that would be to educate and encourage people to do that. If you are suggesting that the government fund a private industry for a specialty service, I just have a problem with that. I think we'd have to have some type of educational program. If we had more specific examples, or you wanted to talk to me later, I could maybe find out a little more what the question is. But I don't personally think that the government should be funding private enterprise for specialty services.
The next question is directed to Diane Whiteside and has been submitted, I believe it's by Push Southwestern. The question is, the Premier has mentioned several initiatives for disabled people. What does your party intend to do for this population?
I've received actually several phone calls from people who are disabled and who are not senior citizens as yet, and they were told that they were going to receive $150 from the federal government, which went to the provincial government, and Peterson it was up to him to distribute that money. As it turns out, many of those people, well, none of those people received their $150. I think Peterson gave them $50, and under the Disabled Canada Pension Plan that they're receiving now, they certainly were living below poverty level as it was, and they certainly needed that extra $150. The New Democrats would definitely make it possible for these people to receive that extra $150, and I don't see why not, why a further allowance is not given to them.
Thank you. Mrs. Smith?
I think anyone who deals in our social welfare programs knows what a mishmash they are. If you apply under this one, you get this much. You apply under that one, you get that much. Even though what may be wrong with you is identical, or whatever your problem is identical. John Sweeney's looking at this whole thing with the intention of trying to put some rationality into it that makes it what your needs are that determines what you get rather than your point of entry into the system. Now, in that light, when the $150 per person coming in one little branch kind of feeder into the disabled was given 150, the Liberal government tripled that amount. So they put in twice as much again, and then divided it evenly among all the disabled that were of the same degree of disabled. So they actually put in a huge amount of money of their own, probably undoubtedly not enough. You have to then look and see if disabled, how they compare with single-led families and so on and so forth. But what was done there was more money was added, but it was divided evenly among the people who had entered the same needs category, regardless which track they came in by. So maybe it wasn't enough, but it was more than the federal government gave, and gave out way more than they would have got by simply applying the federal money and letting it pass through. It was fairer.
Thank you. Mrs. Boyd?
The New Democratic Party has proposed on a number of occasions, probably the most notable being in front of the Social Assistance Review Board, a comprehensive accident and illness assistance plan, so that whatever the cause of the accident or illness, citizens who were disabled and unable to work could count on an allowance that would be equal to 60% of the average industrial wage in the province at any given time. And we feel that in terms of the assistance, the direct living assistance, would be the way to handle the issue of social assistance to people who are unable to work because of illness or accident. Right now, the system is fragmented. You get one rate if you're on workers' compensation, if you qualify. You get another rate if you are on family benefits or Gains Day or whatever. And that is simply not an acceptable way of dealing with this. In addition, we have comprehensive plans that would deal with the whole issue of assistive devices, the whole issue of medication, and medical-related supplies that are required by the disabled, transportation programs to enable them to have greater access, and of course very strong affirmative action and equal pay provisions for the disabled in joining the workforce. So it is an issue that is a very broad issue in terms of what we would plan to do for disabled Ontarians. And I think those plans need to be gathered into a comprehensive plan such as the New Democrats offer in order to be effective and to be cost effective as well as effective in terms of helping the disabled.
Thank you. Mr. Clark?
Thank you. That $150 that the federal government sent to Ontario was for 13,000 specially disabled people in this province. Those particular people are living on less money than our seniors. They're living below the poverty line, and I think that it's disgraceful that that money didn't go where it was intended in the amount that it was intended, rather than the people who needed it the most receiving only $50. It just leaves me speechless.
Thank you. Mr. Mitzel?
I spoke to an individual that was handicapped this afternoon and told me about this $150, and somehow 100 went missing by the time it came to him. Quite simply, as Joan Smith said, she felt that the Liberal government, what they did was fair. This man didn't feel it was fair. And Mrs. Smith says, quite simply, well, everyone knows the mishmash of the social system. Well, who created this mishmash? This guy voted Liberal for the past 20 years, is going to change his mind and vote Conservative. Unfortunately, not voting for my party, was voting Conservative on this issue. That's how strongly the handicapped feel about this. I mean, it's not just $100, it's the tokenism that shows the insensitivity. Thank you.
Thank you. The next question is directed to Joan Smith and is open to other responses as well. Question has been submitted by C. Craighurst from the Canadian Mental Health Association. Question is, Mr. Peterson has pledged $50 million to community mental health services. How do you perceive distribution of these funds in London Middlesex, and what criteria will be used to determine a community mental health service?
Quite honestly, I'm sure the asker of that question knows far more of the details of the answer than I do. I'm sure he will be negotiating that with the ministry.
I've taught life skills they certainly need to have paid professional staff doing that. And we need more housing. The old nunnery on Talbot Street just isn't good enough. These are issues that have to be addressed before the reintegration takes place. Because if people are going to be kept in the community or put into the community after institutionalization, there has to be something in the community that's ready to catch them when they come.
Thank you.
That's certainly something I'd address.
Thank you. Mr. Wyatt?
Ladies and gentlemen, I'm not a health care professional and I'm not an expert, but I did witness what happened when we did deinstitutionalize people with mental illness in Toronto, in Parkdale. Now that was under the Conservatives. Now they used deinstitutionalization as a means of cutting costs, and the result was horrifying. Many disabled people, schizophrenics, manic depressives were thrown out on the street to literally fend for themselves. We in the New Democratic Party believe that we would like to have a lot of people treated in the community. It's always been something that we've supported. We don't believe in big institutions are the answers for virtually all of our medical services. We would like to do it, but we would like to ensure that the support mechanisms are there first. What happened in Parkdale in Toronto was terrifying, and we want to make sure that this never happens. There was literally deaths caused by this, and those poor patients were out there to be victimized. We would like to ensure that there are proper support mechanisms so that the integration into the community is done in a humane way and in a way that is good for the community and the patient.
Just in passing, I maybe misunderstood the question, because I think the problems that have been put forward by both the previous speakers are recognized, and that's why the money has been now put forward. But the question seemed to me to be asking for details of programs, and I'm saying surely that's where we would look to those in the professions to help us rather than telling them. So I certainly recognize the needs as outlined. In fact, I worked very, very hard on behalf of these very problems when I was in City Council.
You're quite right. The question was regarding allocation of the dollars. Mr. Metz.
Well, while for obvious reasons I cannot account for where David Peterson would plan to allocate the $50 million in question, I can, I suppose, offer a suggestion as to what criteria will be used in making that decision. I think our presence here tonight, by the fact that such a question of such a nature has to be addressed to individuals such as us, will prove that the criteria will be political and unfortunately have less to do with the service that's being involved.
Thank you. I'm going to limit this question to Mr. McCaig, who had indicated earlier.
I'm in favor of the program of deinstitutionalization, and if the last 2 years has been any evidence of what David Peterson will do with the funds, you can bet your bottom dollar it won't go to London Centre. He's tried to avoid the press by saying that he's been preferential to his own riding, and in doing so he's neglected the riding. I'd like to see some of that tax dollar spent here in the riding. And I think we've also got to look at the discrimination portion of it too. We've got to deal with the public education on it. We've got to deal with the not in my neighborhood mentality of some of these people where we start to integrate these group homes.
Thank you. The next question is directed to a candidate from each party, and the question has been submitted by the Ontario Physiotherapy Association. The question is, the government, that is OHIP, currently pays more to physicians who run physiotherapy clinics than they do to physiotherapists. Does your party intend to correct this situation? Mr. McCaig.
Position of the Progressive Conservative Party is clear on the issue. We do not favor two prices for the same job. We want to close the gap.
Picard?
Yeah, the Family Coalition agrees with that too. I think the system, the OHIP system, will greatly be expanded, not only for physiotherapists and so on, but to many healthcare professionals, midwives and so on, that we look towards seeing even more access to medical services in the home, and so on, with OHIP funding.
Thank you. Mr. Metz?
I don't really know what the conditions are behind why clinics might get more than physiotherapists themselves. But I do know that if you're going to just equalize things for the sake of making them equal, it's going to be equalized to the higher cost. And that's just going to make the cost of our health care even more expensive. And it seems to me that with so many people concerned about where our funding should come from, issues like this aren't really of concern to our medical system per se, but I can certainly understand why they're of concern to the people who would benefit from this type of thing. Thank you.
Thank you.
I just wanted to say that I found the Canadian Physiotherapy Association report on how all this, once again, mishmash arose, somewhat interesting, because it was really one system existed, then they tried another system and they only used it for a little while and discontinued it, and then there was discussion as to whether the licenses could be sold, etc., etc., etc. And it did create a very uneven and confused picture. When I look at that in one line, physiotherapy, and think that now they're recognizing 25 groups, I realize how important it is that a very comprehensive plan be put in place, not just for physiotherapy, but for all these occupational groups, and the one that we'll be able to continue to live with, and that will serve the interests both of the occupation and the patient, and or the person, I should say, and still not put the whole program completely out of financial kilter, which I think is what has happened in some places where programs have been tried of one type and another. And so I realize that we get impatient waiting for these things to be solved, and yet I realize it's so important that the solution we reach be one we can live with in the long term, and I look forward to it being even. I look very much forward to your continued input into it, because it must be worked out with the assistance of those like yourself who understand so much about it. It also has to entail, which is a very difficult task for you people, your own colleges or licensing systems which require the self-discipline within your systems, and also agreements between systems. I noticed in the physiotherapy report they said we must have this included, yet we must not have anyone else doing what we consider our right to do. That's something that the professionals are going to have to work out together in the working out of this system. It's really very complex.
Yes. I would like to call time in this question to get in one more question before the end of the evening, and this is open to any candidate. Question is, will, in your view, if you are elected, will the Ontario hospital pension ever be based on that of teachers, allowing nurses to retire at full pension considering age and years of service? The comment, it is foolish to think that nurses can work at today's hectic pace until they are 62 or 65 and do justice to nursing. Ms. Boyd.
One of the major parts of our platform, of course, is pension reform, and the whole issue of early retirement has been of great interest to New Democrats for a considerable length of time. Mr. Ray announced not very long ago the plan that we would see as being the ideal. It would be phased in over a 5-year period with the early retirement at the 65-year-old level, the first year at 64, 63, 62, 61. It is expensive, and we certainly have come under a lot of criticism for the expense of the program. Our position is that for professions like nursing, like mining, like a lot of other professions that require a lot of physical work and heavy lifting and have a great strain on its practitioners, that early retirement without penalty ought to be something that we all regard as an important part of our society. So that we believe that is indeed the route that we should be taking to enable people to retire earlier where they wish to do so and where their physical condition requires them to do so. And we would suggest that the cost of that kind of a program would in fact not be as great if we take into account the lessening cost of medical costs for people who are working beyond their capacity at a certain length of time, and also the entry that would be possible into professions by young people wanting to get into professions as early retirement occurs at the top end, so that we would be looking at that kind of a thing. It's a very important part of our program.
Thank you. I'm going to limit discussion because I want each of you to have the opportunity to do your wrap-up. And Mr. McCaig, you had your hand up in response to the pension question.
I think if I gather it right, it's one of the prime concerns of the New Democrats to do this. If it's so important, I've got to question why they didn't include that in their accord with the Liberals. We don't see it today. They have it in all their accords, but why don't we see it with the Liberal deal? I do recognize it as a problem. I do recognize that it's going to cost us a lot of money to solve that problem. I'd be willing to sit down with the ONA and the others that are involved. There are other occupations, like was mentioned with mining. I know ambulance associations are also another problem out there, that where burnout and the stress of the job over the period of time play a big role on the retirement age. So it's something that I'm committed to looking into as well.
Thank you. I am going to end the question session for this evening, and we will then have each candidate do a 1-minute wrap-up of their concerns regarding health care issues. And I am going to entertain candidates in reverse order. Mr. McCaig, you are first speaker.
I want to thank the association for inviting us here tonight. I think we've covered a lot of ground. I appreciate the concerns that have been raised. I think that if you have some chance to talk with me further to this, that you will see that I am committed to bring responsible representation to London Centre and responsible representation to healthcare for Ontario. One of the points that I did mention or didn't get a chance to address with regard to the baccalaureate degree in nursing is that before we actually go into that, you've got to look at the fact that at the University of Western Ontario, anatomy is not a required course for nursing. So I think we've got to look at the quality of the education, too, that we're doing in that profession.
Thank you. Mr. Winninger?
During this campaign, you're hearing a lot of stories about ordinary Canadians from the New Democrats. I have one such story to tell. When I was campaigning last week in London South, visited the Elmwood Nursing Home, which for me epitomized a lot of the problems of the present healthcare system, particularly with regard to the perils of privatization. There we have two parts to the nursing home, one a rest home, one a nursing home. In the rest home area, the residents are paying $24,000 a year to share a room, to eat hot dogs and a lot of Cheese Whiz, I'm told, which complies barely with the government protein guidelines. On the other hand, we have a full nursing care section that can't accommodate a lot of the residents of the rest home who require immediate nursing care.
5 seconds.
And while I was there, I found a man who had slumped to the floor. He could have been there for 10 or 15 minutes, no monitoring device, no one to help him. And for me, that was quite a poignant moment, and certainly opened my eyes to some of the drawbacks of our healthcare system.
Thank you. Ms. Boyd?
Well, I think we've only barely touched on a lot of the issues that some of you brought here tonight, and it is such a shame that we had so many of us in so little time, because I think it cut into the kinds of issues that many of you wanted to discuss. Essentially, I would leave you with the message that New Democrats see our health system as evolving to meet the needs of people, rather than people having to adapt to the set needs of certain parts of the medical profession. We see a greater move toward community-based medicine, a greater reliance on the co-professionals, not just the doctors, to provide that care. And we see a move toward much greater preventive measures in terms of health care, which we think will benefit us all greatly in the long run. We also see a real emphasis on the comfort and care of individuals rather than the emphasis that we now have on cure, because we see that as an area where a lot of people who have chronic conditions or diseases are in fact not being treated well in the current system. And those are just some of the messages I would like to leave you with, and with thanks for having this meeting.
Thank you. Mr. Picard?
The Family Coalition Party sees the healthcare system as technically very fine in Ontario here. It's recommended all over the world, I'm sure. We would want to be particularly to listen to you for your needs for the future. The idea, particularly the elderly, will be a great concern, I'm sure. But to listen to you, what you particularly can suggest and what's needed in your field. We feel that going towards the home care system will take a large load off the institutional care, and we're certainly willing to fund in that direction to bring a better health and more personal health care to all people. Thank you.
Thank you. Mrs. Smith?
The government has showed the emphasis it put on the reform of the health care system from the beginning. First with the passage of the Bill 94 and the drug bills, with its great new program of capital building, $850 billion, which we see already here. We have the new cancer center, the ophthalmology center, the new beds at St. Mary's Parkwood, $14 million expansion, the sexual assault clinic, the big new program in home care, which opens up more beds in the hospital. But this addresses only the physical aspect. You can see more immediately the results in this because you can do it more immediately. You can say, here's the money, go ahead now, build the building. The resolving of the problems that we've discussed tonight is going to require great cooperation, great involvement, and great concern both from you, from the public, and from us. I'm glad you showed it tonight. I certainly have it, and I look forward to working closely with you.
Thank you. Mr. Metz?
Thank you. Everyone sitting here on this stage before you tonight, I believe, is sincerely concerned about the state of our healthcare system and wants to see it work. But sincerity is a much overrated virtue, and good intentions are no criteria on which to judge the practicality of any system. I've heard it said to me many times that being so concerned with the economics of the situation implies that we lack compassion. But I've learned that ignoring economic realities is neither rational nor compassionate. Believe it or not, people have died in other places in the world for ignoring economic realities. I know that the situation that our healthcare system faces is not pleasant, and it's easy to turn a blind eye to the truth when it's not pleasant. And I know that we call ourselves a party of choice, but freedom of choice doesn't mean that you can have anything you want at any time. When it comes to our healthcare, you've got two choices. Are you in it for the short term, or are you in it for the long term? Thank you.
Thank you. Mr. Wyatt?
On September the 10th, you're going to be asked to make a choice. You're going to be asked to make a choice who's going to be running and who's going to be deciding what the healthcare system is going to be like of the future. You could bring back the Conservatives, who have a proven record of how they will treat the healthcare system in terms of the problems that we developed in our physical plant, the fact that we have such overcrowding of chronic care patients in acute care beds. You can give the power the Liberals seek, who perhaps may dance a good tune, but will they be there, especially if they have a majority? Or you could give it to the New Democrats, who have a real commitment to a truly innovative, accessible, and universal health care system. And I believe the choice is obvious. We ask you to consider us.
Thank you. Mr. Clark?
Thank you. I just want to draw reference to a bit of what I heard here tonight. The question of smoking in public places, the Liberals will send it to a committee. And the question of community-based health care, Mr. Van Horn, who has special responsibility for seniors, spent months producing a white paper denounced by seniors groups everywhere as old stuff and institutionally biased. On the questions of beds, for Londoners, the Liberals gave us a bed shortage crisis. On the question of the $100 for those 13,000 specially disabled, the Liberal government shared it with 26,000 other people. I say to you, the Liberals and Joan Smith, you will not buy the votes of London people that cheap.
Mr. Mitchell?
I want to thank you for letting me the opportunity to speak here tonight. I think all registered nurses have one thing in common with the Family Coalition Party, and that is a respect for life. Day in, day out, you treat people, and you try to make them well. Family Coalition Party believes that life begins at conception. It may not be a popular idea, but we believe it's the truth. If you vote for the Family Coalition Party, there's only one way your vote can be interpreted. That is, you're pro-life. You can vote for the NDP for many reasons. No one will figure out why. And same with the other parties. However, there's only one way our vote for the Family Coalition Party can be interpreted, and that is a vote for pro-life. Thank you.
Thank you. Ms. Whiteside.
Thank you. New Democrats support the extension of community health funding to include the promotion of sound health through the integration of the services in community health centers. I bring you a commitment to help them become a reality. High standards have already been set in London North with the innovative world-class research at the 2 teaching hospitals in London North. Community health centers will allow the professionals at the grassroots level to deliver that health care even more effectively. We need to recognize the contribution made by all the supportive professionals within the healthcare system here in London. I hear your voice. I commend you for getting involved. I am convinced that a strong New Democratic voice is needed at Queen's Park if working women and men are to see any effective action on their concerns. I urge your support September the 10th. Thank you.
Thank you. Mr. Minor.
I'd like to thank the registered nurses for having us here tonight. It's been a most informative session. We've learned about problems that we didn't know existed before, and now we can maybe get to work on solving them. I think what you need as your representative is someone who can take action. In the childhood cancer case, we were able to, beyond our wildest dreams, solve a problem in 1 week, thanks to the media. What we need in London South is somebody who can work with you and work with the healthcare professionals. Overall, we need a government that you can work with, that we can all work with, so that we can plan and we can fund and we can deliver the proper healthcare services. Thank you.
Thank you. And
I'm
Ms.
sitting in a
Rowe.
lucky spot today. Luck of the draw. I am confident that I can go to work for you in September. If I wasn't confident, I would not have accepted the nomination as candidate in the Family Coalition Party. It's not going to be terribly hard work for me, as it is for other candidates, because I have a very clear philosophy. I'm pro-life. And what I want to do is to protect life and to meet your needs and address your needs. So I will read your mail and answer your calls, and I will work for you on all issues that pertain to the protection and benefit of your life. I would like to extrapolate, if I might, on what Mr. Mizot said, which seems to be misinterpreted. A vote for the Family Coalition Party is not a wasted vote or a lost vote. We do not profess to win. We don't
5 seconds.
It is a statement. You will be telling the Liberals, the New Democrats, and the Progressive Conservatives that you want your life protected, and they will hear that vote. They will hear your voice if you vote for us.
Thank you.
Thank you.
I would like to take this opportunity to thank you, the Assembly, and you, the candidates, for spending the time with us this evening. And to the Assembly, there has not been time for the many questions that you have submitted, So knowing that they are burning issues for you, we will collate them and send them to each candidate so you may be sure that your issues have been addressed. Thank you for joining the Registered Nurses Association. We hope that this will help you make an informed choice at the polls on September 10th, and a thank you to the Public Library for assisting us in this evening's event.